Prostate diseases affect men, and men in their prime of life, in their 40s to 80s, could have issues with obstruction to the flow of urine. That means the urine does not flow well. Urine flows with a poor stream, you have to strain to pass urine, doesn't empty completely, and you have to go multiple times to empty your bladder. If all this is a phenomenon for somebody in 40s and 50s on a very younger side, or somebody in the 60s and 70s very established and now doing well in their life, or somebody late 80s and 90s, then we need to wake up and help them out today by new era therapy, where we could help patients by a minimally invasive treatment for BPH, benign prostatic hypertrophy or hyperplasia, which occludes the urinary passage as the prostate enlarges, can be treated now without a major surgical procedure. In other words, prostate urethral lift, a therapy where you can actually clip the prostate, remove the occlusion intraoperatively over the next 15-20 minutes without a major surgical procedure or bleeding or stricture formation or trauma, and get a Waddell's test on the table and know that my urine comes out well, will be a generation next for therapies to come. At the Kokilaben hospital, prostate urethral lift has helped very young men to get their flow back and to maintain their sexual dysfunction. To middle-aged men who have got obstruction to the flow of urine and medicines are not working, and they probably have not got the flow which they were aiming for over months and years of therapy. And finally, for elderly men and people with high risk and comorbid cardiac and urological factors who can't get anesthesia, but they deserve their urinary catheter to come out where the catheter is there for a long time. It is important for us to wake up with young men, middle-aged men and elderly men who have got a prostate issue of obstruction and can be treated today with a minimally invasive therapy without having sexual dysfunction in youngsters, without having too much of bleeding and complications of TURP and HOLEP in terms of stricture and incontinence. And finally, for elderly men and seriously morbid men whose catheters are not coming out because they cannot be operated as a result of anesthesia risk, with a minimal anesthesia and sedation, we could actually clip their prostate and give them the prostate urethral lift to lift their morale, to lift their health, and to get them back to where they belong so that they can pass urine the way they should and the way they are doing in the past. Thank you so much.